Hi, everyone. I think that we'll go ahead and get started because we do have a lot of information to cover over the next hour, and I anticipate people will be joining over the course of the next couple minutes, but I am going to get started anyway. My name is Martha Larson, and I am with the Options Project, and I am pleased to welcome everyone to our webinar today, introducing PrepIt, which you will learn all about in the coming hour. Today we have presentations from Allison Cheng at USAID, Nicole Bellows and Catherine Kripke at Avenir Health, Cindy Motzi from the Eswatini Ministry of Health, and Joseph Marungu from the Pangaea Zimbabwe AIDS Trust. As I said, we do have quite a bit of material to cover in the next hour, and we will have time for question and answers at the end of the presentation. However, we do encourage you to use the chat function and not the Q&A function, because the chat function is visible to all participants, so it will foster a more robust discussion. The webinar is being recorded, and after the webinar, we will be sending around a link to the recording. And without further ado, I will go ahead and pass it over to Allison.
Great, thank you. Well, we're excited to be sharing the final PrepIt tool to all of you today. Launching and scaling of PrEP programming requires attention to a number of factors, both in terms of planning and then subsequent program monitoring. On the planning front, ministries of health and stakeholders need to consider the geographic areas and populations at highest risk that they hope to initially reach with PrEP, what impact that prioritization would have on their epidemic, and how best to program accordingly. Modeling different scenarios based on country-specific data can help with that priority setting process. Although I'll note, while that approach is recommended as a practice for prioritizing planning and initial scale-up, longer-term siloing of interventions by geographies or certain populations could have a negative effect on program success. But that said, once the prioritization process has been completed, ministries of health and stakeholders would then also need to consider how many PrEP users they want to target and initiate and maintain on PrEP, how many initial sites would that require, what are the staffing needs, what are the resource needs, and how much will it cost to deliver PrEP then. On the implementation side, programs then need to consider their site capacity needs and seek out program efficiencies whenever possible. As uptake and use over time progresses and demand increases, achievements need to in turn then inform future target setting and program planning. PrepIt is a tool that's designed to support these types of analyses and to be user-friendly based in Excel. It's also designed to be used at whatever level of information or data that a country has available, as you'll soon see. So even new programs can use minimal data and certain components of the tool most have used to them, whereas a more mature program could use more of their own data and more of the features. The concept and idea for PrepIt really originated with country stakeholders. It started when a couple of years ago, USAID with PEPFAR funding supported some modeling work on PrEP in a few countries conducted by the HP Plus project and Project SOAR. However, country stakeholders noted that in addition to modeling, what they really needed was a tool that could also incorporate site optimization in terms of staffing and resources, as well as that program monitoring and ability to do cost analysis. So we're fortunate to actually have some country representatives presenting their experiences on the webinar today with the design of PrepIt, and we're very pleased to be able to share with you the final tool. With that, I'm going to go ahead and hand it over to Catherine Kripke from Avenir Health to present an overview of PrepIt. Thank you.
Hi, everyone. Good morning, good afternoon, good evening, wherever you are. So I'm just going to present a brief overview of the tool. So PrepIt stands for PrEP Implementation Planning, Monitoring, and Evaluation Tool. And it was funded by USAID through the Health Policy Plus Options and ETAP projects. It's an Excel-based decision-making and analysis tool, and it has 6 interrelated modules. That includes target setting, capacity and assessment, and efficiency analyses, tracking the cascade of PrEP service delivery, cost forecasting, estimating impact, and ARV forecasting. So we think of this tool as really having two different types of users. One is people, program planners, for example, people who are in the government or donors. And they're more going to be interested in things like setting targets, looking at the coverage, estimating the impact, and they'll also be interested in projecting costs and tracking progress of implementation. On the other hand, prep implementers will probably spend more time utilizing the functions that do things like assessing the capacity versus their needs, looking at efficiencies in service delivery, projecting client flow, and then like the governments and donors, they'll also be projecting costs and tracking progress. So the important thing to know is that users can really focus on the aspects of the tool that are most suitable to their needs. I wanted to describe a little bit about the process for developing PREP-IT. So we started out with a literature review. We did country visits to Mozambique and Zimbabwe and met with all kinds of stakeholders in each of those countries to get information that informed the development of the tool. We also conducted consultations with global experts like WHO, UNAIDS, other donors, global implementers of PrEP. So we gathered quite a lot of information before developing the first draft of the tool. Once this draft was developed, we pilot tested it in Mozambique, Zimbabwe, Eswatini, and Kenya, and garnered further feedback from stakeholders in those countries about the usability of the tool, additional feature requests, and so on. The tool was revised, and now today we're very excited to be launching it. I wanted to mention a little bit about some trade-offs that we had to wrestle with as we were designing the tool and some challenges. So one is that stakeholders requested a lot of different features, but then they also wanted the tool to be very easy to use. And we tried to address that by creating a tool that has as many of the features as we could incorporate, but also incorporating some navigation help to help people focus on those aspects of the tool that are most relevant to them. Can people please mute their lines if they're not speaking? Thanks. And then another thing that was requested was users wanted to be able to use the tool at any level. So for example, at the national level, at the district level, for a specific program, or even at the site level. So we did design the tool so that it could be used at any level. However, because it's in Microsoft Excel and because of limitations of Excel, the tool can really only be used at one level at a time. So there are a number of different inputs depending on which functions of the tool you're using. The first thing that anyone does is to select which functions they're using to help with the navigation through the tool. And then you're going to, depending on what you're doing, you're going to define the populations, look at your continuation rates, enter your program data, etc. I wanted to focus on a couple of aspects of the tool. So one of them is the continuation rates, and this is a critical component of the tool. It's essential for forecasting the future visits related to the target setting and service delivery. So the continuation rates mean the percentage of clients who are continuing to come back for visits at 1 month, 3 months, 6 months, or 12 months after initiation. And we require input of data for continuation rates for 4 points in time, and we call that a continuation curve. So there are different options for entering continuation curves into the tool. The rates may already be calculated from the country M&E systems. That would be ideal. If that isn't the case and the users need assistance with calculating the continuation rates based on their client records, there's a worksheet for calculating that within the tool. And then if you don't have any information about your continuation rates, but you still want to use the tool and you want to put something in there as a placeholder, we've provided some references from other implementation studies that have been published, and you can select those continuation rates that you think are the most similar or likely to be similar to your program. We also have the costing function, which was designed by our colleagues working on the ETAP project, who are economists and costing experts. And one of the things about PrepIt is that it's costing based on the visit type, because the cost of the initiation visit is different from the cost of continuation visits. And so that enables the tool to account for different continuation rates that are seen with different priority populations, or different continuation rates that can be achieved by modifying the program. And you can see how that modifies your costs. So we have two different options for users to estimate their costs. For users that don't have a costing background or that don't have detailed cost data, there's a cost light, which is as simple as we were able to make it. And then for people who want to have a very detailed view on costing, there's a detailed cost worksheet that can be used. We have done as much as possible to provide default values for costs based on prior costing studies. And ideally, you'll have your own cost data, but if you don't, you can refer to these other costing studies, and we've translated as much as possible into country-specific costs. Now I'd like to talk a little bit about the target setting module. So there are 3 different ways that you can approach target setting. And I just want to mention that for PrEP, target setting is not a formula. It's really more of an art. It's going to be a discussion among the stakeholders. So you might use some combination of these. You might go back and forth between them. So one is, and the most popular is based on coverage of priority populations, which we think of as being kind of a top-down approach. Another one is a bottom-up approach, looking at the capacity for delivering services. If you think that your need is much greater than your capacity, then you might take this approach. And then the third approach is really you can just manually enter targets that you've already created, and that enables you to link the targets to other modules in the tool, to review the coverage, to assess your targets versus your capacity and other things. So this is kind of a busy slide. I'm not going to go through all of it. Nicole will be walking you through some of this when she demonstrates the tool, but there are outputs associated with individual modules, and then there are outputs that take information from multiple modules. So we're really excited to be launching PrepIt today. The tool itself, the user guide, are available on PrepWatch. By the end of the day today, we should have some instructional videos posted, and I hope you'll go and check it out, play around with it, and let us know what you think. I'm going to pass it on to Nicole to walk us through the tool now. Thank you.
Great. So I'm going to give us a real quick orientation to the tool. Unfortunately, we can't do a how-to at this stage due to time restrictions, but as Catherine mentioned, we have instructional YouTube videos that will be up shortly, as well as a user guide that can really walk you through all the various input steps. So I just want to give people an overview of what the tool contains, and hope get some any kind of questions we can have at the end. So a few things to orient yourselves. You start on the Getting Started page, and you note that there's a color key at the top. This is to indicate where the inputs go for PrepIt. Light yellow are drop-down menus and indicate selection there. The darker orange cells are where you input numbers or text. Gray cells are locked or reference data or calculations, and they usually cannot be edited. And green is just an additional color when you set something to yes. So you start by choosing your country. I have a fictional country here. There's a drop-down list with several countries listed. If the country you're working on is not in this list, you can just select other and still use the tool. The advantage of being on the list is there are some country level default data that you'll see throughout the tool that you can use that is not available to countries not on the list. You'll notice throughout the tool that it'll say click here in various places. These are hyperlinks where you can record user notes or we'll give you other supports or guides or other directions to help you. So anytime it says click here, that indicates a hyperlink that you can assess. Okay, so the real function of this page is to think about all the different functionality of Prep-It that Catherine mentioned, and to choose how you want to use the tool, and thus guide you to the appropriate inputs. So you can see there's target setting, costs, impact, capacity, program monitoring, and forecasting. So I'm going to just choose for an example this first one, setting targets based on coverage. You should see in the navigation bar that certain inputs lit up. So these are the steps we need to take to achieve those functions. So hopefully that becomes clear. And then these have hyperlinks. So instead of navigating through the tabs on the bottom, you can use this navigation bar to get where you need to go. I'm going to choose a few different functions here and then walk through them, the necessary inputs. So now that I've chosen my functions, you'll see various inputs have been indicated here, as well as if you scroll below, you'll see the minimum data requirements and additional data entry that's optional, and that can help you get started in preparing to start using the tool. All right, I'm going to quickly move through these steps. Populations is where you specify the priority populations receiving PrEP in your program. And again, these can be selected from a drop-down list, or you can create a custom group and then type right over in column C, the orange bar. At least one priority population needs to be specified, but if you're not distinguishing between different types of clients or different groups, you can just specify one population and have it be all users. And then the acronyms in column C, they populate throughout the rest of the tool to help show you where to put your inputs. Continuation, Catherine mentioned the continuation curves, and you can see from these data points that we've entered here, that there are these corresponding curves that indicate how long people have been staying on PrEP after initiation. So you need at least one continuation curve in the tool, and there's space for up to 6 different ones. And then each priority population needs a curve assigned to them. Catherine mentioned that if you don't have this data available, you can use the continuation calculator. That's built in here. The results are here. This is tracking client level data over time in terms of their dates, their visit dates, and the drug supply they're having. So over time, you can track when they come in and how much drugs they have for a sample of your clients, and that will then generate these results. And there's, again, separate tutorials for all these different steps. Finally, we have the reference table of empirical studies if you want to use those to help estimate your continuation rates if you don't have that data otherwise available. Moving right along to initiation. This is where you track your monthly initiation information. And again, the minimum input here is in red. It's initiated PrEP, including reinitiations. And so those you can track each month. There's room for up to 5 years of monthly tracking. And that's the component that really ties into the other modules. However, there's also a lot of interesting metrics around initiation and the PrEP cascade that you can also track by month for program monitoring and evaluation purposes. So you indicate in this column here and this step here what data you're tracking, and then below it'll indicate where to put your data in with the orange cells. From that, you can click on the initiation results and see a lot of different measures summarizing PrEP cascade. And there are 2 graphs here. This is a nested cascade that can help you identify where program improvements might be made. A second cascade is where the denominators amongst those screened for PrEP. These graphs are dynamic, so you can look at it overall, or you can look at by priority population. Additionally, if you have multiple years, you can look at it by year. So that's just one of the outputs that you can look at. I'm going to move to capacity. Here, the minimum input is that if you already know your total monthly capacity, you enter it into cell C3, and that can link to the other modules in the tool. If you don't know your capacity and you want to calculate it, the rest of this worksheet is helping you do that by building up your capacity from service delivery units, which can be sites, clinics, hospitals, mobile teams, etc. And we're looking at elements of capacity around staffing, laboratory capacity, demand, meaning the number of potential clients per month or the number of people coming through the door asking for PrEP, as well as drug capacity, which is allocated from a national or regional level. And based on those inputs, you can get the capacity at each site, as well as the bottleneck. So what is preventing greater capacity to be delivered? And so there's a lot of outputs on this related to not only calculating the capacity, but also thinking about resource allocation and efficiency analysis and how to use the capacity that you do have most efficiently. Moving to Cost Light. Cost Light is the simpler of the two costing modules, but we really think that it's important to look at costs by visit. And so that's the sort of the distinctive approach that we've taken here. The first thing you need to do is set up a visit schedule. So starting with initiation, if one were to stay on PrEP for an entire year, when would these visits occur? So you can see I've set up one here. You can set up to 3 if perhaps there are different schedules for different populations. From then, you specify your monthly ARV costs and then go into these costs by visit. And their costs are by initiation visit and continuation visit with the subcategories you see here. And again, we provide default values. These are based on analysis of 6 different costing studies with country-specific data used around salaries to help estimate to the best of our ability what these per visit costs would be in the particular country that was selected on that Getting Started page. From this data, then it yields the annual unit costs per person to stay on PrEP for an entire year, but also the cost per person initiated, and this is accounting for the continuation rates that were previously specified. Additionally, you can see how costs, monthly unit costs decrease over time the longer one stays on PrEP, because of these more expensive initiation visits generally. I'm going to skip detailed costs for sake of time, but just to say that it does allow you to get much more fine-grained in your cost specification. It allows for task shifting analysis, and it has a lot of functionality for costing experts and people who are familiar with working with that data. Targets. Okay, so for targets, Catherine mentioned there are 3 approaches. The first one, when you base targets based on coverage, you first need to estimate the number of potential users. And so in order to do that, we need to know about what's the population size, where are we delivering PrEP within the national population, HIV prevalence, and as well as the percent indicated for PrEP, meaning those eligible or those considered most at high risk for HIV. Again, we provide some country-specific default values that one can use, or if they have better values that they want to use, better data, then we encourage them to use the best data available. But there are some defaults in here to help with this particular input. One needs to specify their scale-up trends, how they're rolling out PrEP. When there's a few different shapes that one can use, as well as ways of manipulating the shapes to best represent the way they plan on scaling up. And at least one scale-up trend needs to be specified, and each priority population needs a scale-up trend assigned to it. And then we get into setting our target. I've set it here for option 1. And then setting the coverage. So based on the percent of potential users who will be taking PrEP at the end of the target setting period. So once we get to the end, what proportion of those users do we want to be taking PrEP. So you specify those here, and then you can see I've run the solver button, which generates these targets. It solves this equation of, based on the number of potential users, the continuation rates, and the scale-up trends, how many people do we need to initiate PrEP in order to reach that coverage level by the end of the target setting year. Option 2 looks at your capacity and helps you set coverage based on that instead. And option 3 is where you just manually enter them in, and therefore they can link to the other modules in the tool, like costs and impact, et cetera. So you can see, kind of do some more planning around that as well. I'm going to skip impact, but just to say that it's a fairly simple module that doesn't require a lot of impact from the user, but it's an important output. We also have disaggregate targets, that if you want to take your targets and disaggregate them by age, sex, and sublocation, there's the functionality for that. And we're going to look at drug forecasting. This is assuming you've done either put in your program data around initiations, or you've set some targets. Then you just simply specify the number of pills per client per day and the cost per pill, and it will give you these associated outputs around the number of pills required and its related costs. So you can see with this output is sort of bringing together already a couple of different modules to show you, what you can get out of PrEP. The rest of the outputs related to that are on the results dashboard. And there's a lot of information here. For time constraints, we can't go into all the details of them, but what we can do is we have here this results navigator. And this is really to show you, what are the questions that we can answer with PrEP, and then how do I find those answers? So generally, these are bringing together the inputs from cost, impact, and capacity with either your program data, what you've currently been implementing, or with your targets. So if we were to look at targets here, how much will it cost to achieve these targets? And what impact are we going to get for the money? We can go directly to table 1B to kind of see those answers there. And these have hyperlinks in them as well. Similarly, we can look at, what is the cost and cost effectiveness of providing PrEP to the different priority populations, and see these cost effectiveness comparisons. If we want to take more of an implementer's perspective, maybe we want to ask, how do our costs compare to the costs that we should be seeing based on the inputs we put in, and what is the projected impact of PrEP that we've already provided, which we could use for advocacy purposes. In terms of implementation, it's both retrospective and sort of what have we done, as well as prospective, thinking, okay, based on our current implementation trends, how many visits can I expect in the next 3 months? So we have data on that, as well as, given that, do we have any capacity concerns that are forthcoming in the immediate future? So there are other more detailed outputs related to costs, as well as results by month. So again, how many clients were estimated to be on PrEP in any given month? And that retrospectively and then prospectively, what are our expectations around how many clients will be there each month based on our targets, including both initiation and these continuation visits that can help with planning. There are a couple of other outputs specifically to disaggregating targets. You'll note here that these are not green or in bold. That's because on the Getting Started page, we did not select that disaggregate target that function. So that's how you can tell whether or not an output table is relevant to you based on the inputs you made on the first page. So that was very quick, but that's what I could get done in 15 minutes. And I think we're just really excited to share this and get a lot of feedback from users. So I want to thank everyone, and I will now move on back to the presentation. So I'll hand it over to Cindy Matzi to talk about her experience using PrEP in Eswatini.
Hello, everyone. As alluded, I will be presenting on our experience in using this tool in setting our targets. As a country, we started implementing PrEP as demonstration projects in 2017, and we were supported by 3 partners. And based on those results, we approved PrEP as part of the combination HIV prevention package in 2018. And we were to roll out nationally this intervention, and it's being coordinated within the National AIDS Program, which is a unit within Ministry of Health. So based on the demonstration projects, we identified 8 priority populations, which includes serodiscordant couple, sex workers, men who have sex with men, adolescent girls and young women, transgender people, pregnant and lactating women, and high-risk males aged 30 to 34. And as part of the scaling up plan, we're supposed to come up with a target, which included the national, regional to us, it's equivalent to the district, and also to disaggregate further by the subpopulation or the priority populations. And we were lucky this year in June, as we're struggling in coming up with in setting up the targets. We were part of the countries that were supported by USAID to benefit from the PrEP tool workshops, which were implemented through Health Policy Plus, Option, ETAP 2 projects. And we're very excited when we saw that one of the functions of this tool was to set a target where we're struggling. And we took this opportunity to set our targets, which were to be national, regional, and also per a subpopulation group. Next slide. So the process of setting the targets as we're using this tool, what we have seen is that the tool it does not automatically set the targets. However, it provides a useful framework for discussing the desired approach and key assumptions. Also, the tool provides a visual way to show the impact of decision as it relates to the target setting. So during the workshop, as a country, we chose the option 1 coverage approach, which is a top-down approach that we later modified to include desired coverage of the specific population, site capacity, and we also considered the number of sites that we're going to be providing PrEP in the country. Then in terms of the priority populations, as I've alluded, that we did identify about 8 populations based on our demonstration project. So during the process of target setting, we considered their population sizes per population group. We also considered the HIV prevalence, which we got from our local data. Where we didn't have data, we considered what is available globally. However, I must say, under the, again, when we wanted to determine the percentage indicated for PrEP within this population, that one was very difficult. We ended up using the default figures to start the discussion and consider the dynamics of these groups. What we also saw using this tool, we're able to come up with continuation curves for the general population based on the demonstration project data, the continuation rates, and we're also to use the same continuation rates that we got from the demonstration projects for the different priority population. So this tool helped us to understand the consequences of changes in the continuation rates. So as we are scaling up PrEP, we have decided as a country that we are going to use the program data tab, which is part of the tool to integrate in our M&E system to track the progress of the intervention. That is our PrEP cascade. And we have also seen that at this stage, as we're rolling out, since we haven't integrated the PrEP module in our CMIS, it's not easy to track what is happening with this intervention. But then as we continue with the integration of PrEP module in the CMS, we think that it's going to be helpful to also understand the progress in rolling out this intervention. Then for the coverage, we use the experience from the demonstration study and program goals that we had there to inform our coverage. So it's easy to adjust by playing around with the coverage when you're using this tool. Thank you.
So next, I think we're going to have Joseph speak about the experience in Zimbabwe.
Hello, everyone, and thank you for the opportunity for us to share our experiences on the so just to start off by highlighting our journey in terms of PrEP in Zimbabwe. I think our main milestones were the development of the guidelines in 2016 and having the first pilot implementation in the public sector in 2017. And within that period, we also had a chance to use some of the tools that were developed with support from options, including the landscape analysis, rollout scenarios, and readiness assessment. And then in 2018, we launched our national PrEP implementation strategy. We are currently in year 2 of implementation. More recently, we have launched the comprehensive HIV communication strategy, which also looks at communication for PrEP. And as of now, we have over 11,000 people. But I wanted to bring your attention to the time point at which we started the process of developing the PrEP tool, which was after the development of the national implementation strategy. This is important because it will help you understand some of the challenges we faced as we're going through this process. Next slide, please. Yeah, so the development of the PrEP tool was a widely consultative process with different stakeholders participating in the process. So we had mainly the National PrEP Technical Working Group, which is led by the Ministry of Health and Childcare, but also has implementing and funding partners. And the main players in this process were Pangaea, PSI, CHAI, and we also had the team from USAID and CDC participating in the exercise. Also, we had an opportunity for the program managers from different organizations, as well as PrEP providers in both the public and private sector, participating in this exercise and also practicing on the use of the tool. So this helped a lot in terms of getting buy-in, but also in the refinement of the tool to suit local needs. Next slide, please. When the tool was introduced, there was a lot of excitement because based on the implementation experiences, the tool had the potential to address some of the gaps that we had identified, notably issues to do with subnational levels, because we're struggling in terms of how to set up targets for districts and facilities. But also the issues that we were struggling with was how to monitor and track continuation. So this came at the right time because it was going to then help us address those two main areas. The good thing also is the tool is Excel-based, but the engagement of everyone in the development of the process meant the tool was also going to be responsive to our needs. Yeah, just to highlight some of the challenges that we came across when we're developing the tool. The main one was the unavailability of local data, not but also size estimates for some of the population groups that are prioritized for PrEP. For example, men who have sex with other men, and this was needed to inform the assumptions. We also had some challenges convincing stakeholders on the added value, given that we already had We also had modeling and costing exercises going on at the time of initiation of the development process. However, as we went through this process, we then managed to get buy-in as people then started to appreciate the value from the tool. Next slide, please. So our last stakeholders meeting was in June, and since June 2019, we've received some feedback in terms of people's experiences in terms of using the tool. The first thing to highlight is that people are finding the tool overall functional and useful. And it's also quite comprehensive in terms of mainly target setting and tracking continuation. This is mainly because the stage where we are in terms of PrEP rollout in the country, the main focus in initiations and continuation. So those are the two most popular components of the tool that are being used mainly at subnational level. However, the challenge is that some of the facilities that might want to use the tool is that they don't have laptops or computers or electricity on site, so it becomes a challenge for them to use the tool. But also just to highlight that some of the tools at subnational level, and especially, for example, the costing tool, because resources are allocated from national level and at district and facility level, there's nothing much they do in terms of allocation and costing. So there hasn't been a lot of use of the costing component. So what was being used mostly the target setting, evaluation, and the impact components. So going forward, next slide, please. As we continue to roll out PrEP in the country, we are going to be training people on the use of the tool and then disseminate it further through training and mentorship, and also to then monitor implementation through tabs. At a higher level, the plan is to use the tool to refine our national targets on an annual basis, but also to use the tool to inform planning process, including more recently the quantification exercise that we have just had, because some of the assumptions that we use can be generated from the tool. Thank you very much.
Great, thank you, Joseph and Cindy, for sharing your experiences. And I think that we really appreciated all the feedback we got from the partners in Zimbabwe, Eswatini, and Mozambique, and Kenya. They really helped us to push us to try to improve the user interface. And I think that we have a better product as a result of their collaboration. I think at this point, we're gonna do Q&A. I don't know if somebody wants to start us off. I think we're going to have maybe Martha selecting the questions.
Yeah, hi, thanks everyone. I've gone ahead and allowed all attendees to speak. I think you guys all are on mute, but if you do have a question that you want to ask, please unmute yourself and ask it. But during the course of the presentation, we've had a couple questions come in. I'm going to go ahead and start with one that we got from Eckhard Kleinau, and his question was, what was the timeline for options and of course HP Plus and ETAP to develop the tool from design, development, testing, and then finally rollout, and was it field tested anywhere besides Malawi? So I'm going to go ahead and let Catherine and Nicole answer that.
Yeah, thank you so much for that question. We have been working on this for a year. We started October 1st of last year. And I'm looking at I lost the question. What were the other parts of the question?
Places where it was rolled out.
Yeah.
Yeah, so it was tested. It was field tested in Zimbabwe, Kenya, Eswatini, and Mozambique. We didn't actually do a pilot in Malawi, but we made the tool available for stakeholders there and they wanted to use it for their target setting, but we didn't do a country visit and a training and that like we did in the other countries.
Can I go into that?
Okay. That's great. Thank you, Catherine. We had an early question from Jane. That is, at what point are clients given less than 1 month tablets during initiation included on month 1 continuation? So I think Nicole was going to answer that one.
Sure. So in terms of continuation, we can talk about the continuation rates that we put in that tab. And those, I mean, the decision making around how one has calculated those, if they're from existing M&E systems, is flexible depending on how each program wants to specify that. If you're referring to the continuation calculator, what that's really putting in is it's looking at visits and the number of drugs that were dispensed. So if you were given less than a month's supply at your first visit, that's fine. Maybe you were given a week supply. It just means that we need to know that you came back, you know, within a certain amount of days after that week and received more. So it's not tracking a visit schedule. It's really just tracking the number of days that you've got drugs on hand. And you can also sort of adjust how late they can be to their appointment before you want to say that that's no longer, that they discontinued. So hopefully that answers the question with regards to the continuation calculator. I can't speak for all the different programs and how they measure it themselves as they proceed.
Nicole, there was also another question about the continuation rates that maybe you can address. I'm looking for it.
Oh, I saw about whether the denominator of clients stop when they're no longer at risk. That one?
Yeah.
So we talked a lot about this in the development process about, you know, if somebody stops taking PrEP because they are no longer at risk, that's appropriate. So how do we kind of tease out what is discontinuation that is maybe, you know, appropriate from where we would like want to encourage them to stay on longer. And in the continuation calculator, there is a space to track the reason for discontinuation. I think the challenge is often we don't know what, you know, we won't see clients coming anymore and we don't know why. And so it's hard to gauge that. But there is a space to track reasons for discontinuation, and therefore you could adjust your continuation rates accordingly.
But I think the question was, does the denominator change if the clients stop PrEP because they're no longer at risk? And we didn't incorporate that into the continuation curves. It doesn't have the continuation curve that you're entering on that module doesn't have anything to do with why people stopped. It's just, did they stop?
Right, correct.
And it's important not to adjust that because those rates are going into the cost and impact calculations.
Okay, thanks. We have another question from Evan Doyle, and his question is, in Zimbabwe, if stakeholders are using the tool at the subnational level, how are their outputs being linked with previously agreed upon national targets and PEPFAR targets? And while this is about Zimbabwe, I'm sure it applies to most countries. So.
Maybe
Yeah,
Joseph
so
can take that one.
for now, it's easier because we have few districts and few then the numbers about and also the distribution of the drugs that are put in place, like training. But I think in the future we'll need a robust system to ensure that everything is feeding into the targets for a at the national level.
Joseph, you were kind of breaking up when you were speaking. I wonder if you can type your answer into the chat box as well. That might be helpful.
Okay, I'll do just that.
Thank you.
Oh,
Cindy, did you want to say something about this question with respect to Eswatini? If the stakeholders are using the tool at the subnational level, how are the outputs being linked with previously agreed upon national targets?
okay, thank you, Catherine, for that. But I wanted to start with the PEFA having set their targets prior to us setting the targets. I just wanted to say it's easy for us because we are setting targets at national level. So whatever they have, they are feeding into the national level. So in terms of the last question of how the partners at regional level are using this tool, yes, they are using this tool as the expectation. The good thing is that it was the Ministry of Health who was involved in all this, and we introduced and requested the cascade of the same tool to everyone who's implementing PrEP in country. So it becomes easy rather than if it was coming from an implementing partner. So yes, even the outputs, although now we haven't seen the good result based on our data because we are still trying to link a module into our CMIs, and then we can get the bigger picture as we collect the data from everyone else. Thank you.
Thanks, Cindy. I see there's another question from Evan about how impact is being calculated by the tool. So the impact estimates in the tool are very rough estimates. It's not rigorous dynamic modeling. It's really just meant to be indicative. And the impact estimates are actually coming from goals modeling that we ran on all of the countries that we had goals models set up for. And we estimated the number of HIV infections averted per person year of PrEP by each of the populations that was in the goals model. And then we did some adjustments to incorporate additional populations that aren't in goals based on other data. And this is infections averted in the whole population. So it includes the downstream infections averted, and it's calculated over 5 years. Martha, do you want to read the next question?
Yeah, so Eckhard had another question, which is, what is the experience from Mozambique and Zimbabwe about training needs for the tool users? Is training needed? If so, how long? And I think this will probably have to be our last question.
So we did workshops in the 4 countries on the tools. Maybe it might be nice for Cindy and Joseph to weigh in about whether that training was sufficient or whether they think that additional training was needed. We conducted training, a couple days of training, going through all of the modules of the tool. The feedback that we got from users was that there's just a lot in the tool and they could have used more time. But I don't know, Cindy and Joseph, do you want to say anything about it?
For us, during the training, we were able to invite every stakeholder that was going to be part of this. So majority of those that are part of the implementation, they attended that workshop, and I don't think we need any extra training. It was sufficient to have the training for everyone.
Yeah, so our experience is similar to Eswatini, but one of the things that we've realized is that we then need to have follow-up training and mentorship for people from the district and facility level if they're to use this tool effectively. So that can be done by teams that are already mentoring the sites or providing support and supervision, and it will be done on site.
So Joseph, do you feel that the people who were at the initial workshop are now capacitated to train others at the local level?
Yes, they are.
And so in addition, we now have a comprehensive user guide, and we have a series of YouTube tutorials on how to use the tool. So we're hoping that users will be able to use those resources and get started with the tool themselves, although our team is, would love to work with more countries on training people to use the tool and applying the results and customizing things for the country context.
All right, thanks, Catherine. It is 9 o'clock, so I think that we will wrap things up. If you have additional questions, you can email Nicole or Catherine or myself. We will be sending around, as I said, the link to the video, the presentations, and I think we're also going to try to answer some of these chat questions in a resource sheet that we will also share. So thanks again, everybody, and have a nice day.
Thank you.
Thank you.
Thank you.
Thank you.